Welcome to the Center for Innovation in Campus Mental Health's Conversations Over Coffee video series. My name is Perlin, and I am the Research and Knowledge Exchange Coordinator for the Center. Joining us today is Seija Korpela and Alison de Luisa from Cambrian College. Hi, thanks for coming in.
Thanks for having us here.
So just a fun fact for you, we're not in Toronto right now, we're actually in Sudbury because later today we are hosting a Northern Forum, which is bringing together a number of post-secondary institutions to talk about unique barriers in Northern Ontario and also brainstorm for solutions. So Seija, who is the director of the Glenn Crombie Centre for Student Support at Cambrian College, and Alison, who is the Associate VP of Student and Employee Development, we're just going to pick their brains a little to talk about what they've seen on their campus and also in the North in general. So do you feel that there are challenges and barriers that institutions in the North face which are unique to this part of Ontario, even this part of Canada?
Definitely. In the North, we have more geographic barriers when we look at the students that do come to our campuses. We also know in the North we do have some more health issues than you would see in Southern Ontario. And we also know that in terms of our students, right now at Cambrian College, 20% of our students are Indigenous, and we also have a high percentage, which is getting higher every semester, of international students in the North.
So you mentioned health challenges that are different from Southern Ontario. What sort of health challenges?
We do know that just some of the statistics of health are not as great in the North. Now, I would say with mental health, I haven't seen those statistics, but we do know that Cambrian College, like other campuses in both Northern and Southern Ontario, we have seen a large increase of students that are presenting with mental health challenges that we just would not have seen even 5 years ago, 10 years ago.
Yeah, we're certainly seeing that across the board as well. Like it's kind of that catch-22, like wait lists are getting longer, people are presenting with more complex cases. It is a challenge. What do you think, or rather, what are some of the ways in which you've seen that campuses, including your campus, have risen to meet those challenges?
So Cambrian, as well as other campuses in the North, we continue to partner with organizations that exist in our community. So one organization that we do deal with quite frequently is crisis intervention. When we do have a student in crisis, having those relationships so that we can help our students in need. The other thing I would say that is an advantage to a smaller school like Cambrian or other colleges in the North is the collaboration that occurs on our campuses. So you look with just smaller staff that we have, we know who to go to. So if a student comes to us with unique challenges, the collaboration and reaching out to different people within the college is really quite fantastic as we focus on student success. So that means faculty will come to the Glenn Crombie Centre and ask for supports when required, and we rely on one another. We actually call it a Cambrian family.
Yeah. So last year at the OCSA and CCVPS meeting, which we attended as well, we did a breakout session and asked the Northern campuses what the main barriers were in the North. And yes, what we did here was like, general, the geography is challenging and the isolation. And that also meant limited community supports and the challenge of hiring experienced staff who might have like a diverse experience. What are your thoughts on that?
Yeah, I would say in Sudbury we can get qualified staff, so that's an advantage to being in a larger northern community. But the geographic challenges are quite high for us. When we look to, I think something that I'm really quite proud of is the recruitment that we've done on the James Bay Coast and the recruitment of Indigenous students. And at Cambrian, for Indigenous students, we're looking at a home away from home and what student supports did they need that are unique to their needs. So looking at that. So an example is that we brought on more elders this year. So to focus on their needs. And we have a cultural facilitator that we have to address their own cultural needs. We have smudging on campus. So looking at the whole person and looking at what meets the needs of our students. I would say when we have a population of 20% of our students are Indigenous, that's critical for their success, that we provide student services that are appropriate for them.
Absolutely. Do you also have, oh, sorry, I think you were just about to
No,
jump in.
I was just going to say one of the other challenges is finding supports for students in the evening. In Southern Ontario, you have more counselors working into the evening and so on and so forth. So a lot of our students have to access external resources during the day when they're in school. So then it becomes a choice between attending class or seeking the help that they need.
It is difficult. Do you often refer out for supports, like to the community?
Yes, we have in our department for students that need ongoing therapy, we do refer them to external therapists.
And these are partnerships that you have with local organizations?
Yes.
Could you elaborate on that, perhaps?
Well, I think it's mostly private practice, individuals in private practice. So we have a data bank of individuals that we can refer them to. If, for example, there could be a psychotherapist who's an expert in autism, so they could support a student with autism. So we're aware of what is in our community for the students.
That makes sense because you don't necessarily have all the resources on
That's right.
campus. Yeah, yeah.
And we're also looking at developing more of those relationships within the community. So instead of our students having to go elsewhere, what we're looking at is developing partnerships so they can be offered on campus. What we find often is if we refer our students somewhere off campus to, let's say, a therapy group or a mood and anxiety disorder group, sometimes they just don't want to go. It's the barrier of getting there. So what can we do and what can we provide on campus? And so that's being looked at.
Yeah, I guess that speaks to the geographic challenge that you were talking about. I guess public transit is more challenging here compared to, say, downtown Toronto.
Yeah, absolutely. Yes. And the other thing we have is a student assistance program. So students can call online, they can call a line, or they can go to an app and get counseling 24/7. And that's critical for us because, as Seija was saying, we don't have those services beyond a certain time at the college. And often it's our students in residence or when they're off campus that they need supports. So that's been implemented over the last few years.
That's great. What's the name of the app?
It's through Aspiria, which is our student benefit provider.
Oh, I see.
Yeah, so we're very pleased to offer that to our students as part of their health plan.
That's great. Earlier you were mentioning that about 20% of your students are Indigenous students. Do you think that, well, obviously in the North you have a higher percentage of Indigenous students compared to Central Ontario. What are the other differences that you think exist in the demographic of students here? Like, do you see like less international students, more international students? What about French language?
We have more international students coming to Cambrian College every year. So being able to, for our staff to be prepared, understanding the cultural differences. Our Cambrian International Department does a fantastic job acclimatizing students to the North and how to access services. I think it's a work in progress to be able to fluidly access services within the college as well.
And a challenge with international students is sometimes the stigma of accessing a counselor, that they are worried that that will affect their visa. They don't want their families to know from back home. So we do quite a bit of work in conversations with international students, just that it's not like that here in Canada, but we also need to respect where they're coming from and meet them where they are.
Absolutely.
And the stigma exists in a lot of the countries that the students come from as well, international students. They don't have the programs that we have here in Canada and Ontario. So teaching them the cultural differences between their home country and ours is not a barrier, but it's something that needs to occur for these students.
It's oftentimes a long conversation.
That's right.
Yeah, because they're very used to whatever culture they have growing up in, and like mental health being something that you don't talk about, you don't present. So yeah. One of the things that we've seen as being one of the difficulties of being a Northern institution is the challenge of declining enrollment rates in the last couple of years. I'm not sure if you've seen that, but there has been more of an exodus to the center of Ontario, like the U of T, McGill, well, not McGill, sorry, U of T, like Guelph, those areas. What does this mean for departmental budgets and making sure that there are enough resources to support your students?
That's a real challenge, actually. Certainly in the north, that's a big challenge. We continue to talk to the government about our northern challenges. Bill 148 has also provided another challenge for us in the north as we work through what that means for us. What has helped, actually, from a ministry perspective, is they have provided specific funding for us. So an example is we have a posting up right now for an additional counselor. That came through with specific funding that had to be spent on mental health, and that can't be touched. So as we review operational budgets, that money is set, so that's a great resource. But it really is a challenge for us. I think like I said, we continue to talk to the government about some of our funding challenges and what that could mean and what we need moving forward. We do have declining demographics, certainly for domestic. But what we are also doing is recruiting more international students. But we also need more supports for international students as they come and they require housing and they have their special needs also.
Yeah.
One thing we've done that has really worked well for our students is doing activities that with our Indigenous students and our international students. And that really seems to have worked because some of their challenges are the same, as we have some of our students that come that are Indigenous coming from the far north and other international students. They've had great social interactions, and those social interactions have made a difference for them at these social events that have been planned.
Right. It's about creating a community as well. Do you think so? Yeah, yeah. And yeah, oftentimes in smaller institutions, more isolated institutions, one of the advantages offered is that kind of tight-knit community. And it is happening at your college. What do you think that means in terms of like referral pathways? Is there like a formal referral pathway? Say a student has some sort of concern, they're in stress, like what usually happens at a smaller campus where everyone knows everyone and it's very warm and inviting?
Well, I think throughout the college, Cambrian has invested in mental health first aid training across the campus. They do, students can come down to the Glen Crombie Center for supports. We will meet with them. Again, with the resources we have, we may have to refer them externally if our staff are already meeting with other students. So we do the best that we can. It does pose challenges at midterms, finals, when the stress is a bit higher. But it is a work in progress, and we're looking at improving those. But I think the more employees and even students that have training in mental health first aid and in those areas, having that peer-to-peer support from the top down, I think will make a difference.
Yeah, what you're doing is increasing access points as well, making sure that
Safe
nobody
places.
falls through the cracks.
Yes.
Absolutely, yeah.
And we try and focus on that circle of care. So often when we talk about mental health, it may not be at the moment that a student requires counseling. They may be in mental distress because they can't eat that day. They need more money because they're very stressed that they can't pay their rent. So we have hardship bursaries. The other thing we have are set aside funds that we put into providing student employment on our campus. And I think if there's one thing that we can really, that we have focused on amongst many things is if a student is in need financially, can we provide student employment for them? That provides connections, it provides purpose. And we do that across our campuses. And those jobs for our students are really for those students in need. So it's really about the whole person and looking at what their needs are. So it may be that they, like I said, they need a bursary, they need a bus pass for the day. And we're very good across the college at kind of recognizing some of those needs. And also we do have a committee that looks, as a circle of care, looks at certain student situations and how can we collaborate more to focus on the student and provide the resources that they need, and so that they're not going to different spots on campuses for help. That it may be a student requires help in residence, but then we'll have one point of contact to say, okay, who can that person go to that can explain all the resources that we have. The other thing we're quite proud of, and it's very new at Cambrian, is as we talk about mental illness, we're really trying to change that conversation to mental wellness.
Yes.
So we posted a position just in the fall of a wellness coordinator who will bring together all the activities that we have on campus and create more to really help our students with resilience, to help them focus on their wellness. So hopefully they don't get to the point where they do require counseling or they need to withdraw because they're not coping well. So that's a new position that we decided instead of focusing on another counselor, that's what we would do. And actually at Cambrian, we have a committee already that has come together, this impromptu committee that represents staff from across the college and to focus on student wellness. We also have committees that focus on our employee wellness because we have to take care of each other. And the more we take one another and we look at the mental wellness of our staff, the more we can take care of students. So we have so much going on our campus, and sometimes it's just pulling it all together and having those conversations and understanding where all the resources are to focus on student success.
Yeah, that is very important. Like mental health doesn't just happen like in isolation. It requires so many different moving parts, like the health of your staff. It does affect a lot of other things. That's great. Like it sounds very similar what you're doing to the step care model in terms of
Absolutely.
yes,
Absolutely.
getting people early on, and you don't necessarily have to go all the way to like counseling. What happens initially is the mental health promotion piece is really important as well. Yeah.
And the other thing we're promoting on campus, and we have a draft of a mental wellness framework that we're ready to roll out. But a big piece of that is to say that as a college, we're here to provide education. And our goal really at the end is that a student comes to Cambrian and at the end has a diploma or a degree and has a good student experience and is ready to enter the workforce. And we're not a medical institution. So what we don't want to do is have students rely on counseling services and then be a graduate of Cambrian and still rely on those. So we have to be very conscious, and even as we have those conversations across our campus, say we're not a medical model, we're not a hospital, but we recognize that we do have a demographic that we need more resources, but we can't have our students rely on that or they can't move beyond graduation.
I think one of the most profound experiences I've had at Cambrian was during graduation last year. And in terms of internal collaboration, we had a student who wanted to be part of the graduation ceremony, but the group was too large and their anxiety was such that they weren't able to participate. At the end of the ceremony, we approached the Vice President of Academics and the President. They had a ceremony after everybody had left for the students, so they got to walk across the stage and get their diploma and have their photo shoot done. And I think in terms of community, one student, every student matters, and when we can intervene, we will.
That's great. And I guess this is one of the advantages of actually being a smaller institution where you can have those personal connections and actually really, really take care of every individual student. Yeah. So just switching gears here a little bit, across Ontario, but particularly in the north, strong partnerships with the local Indigenous communities are becoming a focus for the ministry and just in general. Can you speak to some of the local initiatives that you've seen which focus on supporting Indigenous students, whether it's on your campus or what you've seen in the community?
We have a number of activities that we offer on campus, And we are in close contact with our communities. And we also have an Indigenous circle that is part of our board that we go to for advice. So on campus, we had a number of events last year that focused on truth and reconciliation, and we will this year. We have a number of social events, and I think what was one of my most profound moments was sitting in the arbor 2 years ago and just asking the students, what keeps you here? What matters to you? And the diversity of what mattered. So one student said the Indigenous fashion show. I was in the fashion show, and that was great. I never thought I would be in a suit on that, because it's men and women, and just how that made an impact. Another student said, I like to come to the arbor and smudge, and I know I can smudge at Cambrian every day, and that makes a difference. Another said, you know what, I like to talk to Nokomis, who is our elder on campus. That made a difference for me. Another said, I worked on the Moose Hide campaign, and the Moose Hide campaign is to recognize murdered and missing Indigenous women, and that's a student-driven campaign that we have at Cambrian. Another said, the powwow. I was involved with the powwow, and that was great. And we implemented the powwow after, I think it was about 10 years that we didn't have one, and we brought that back a couple of years ago. And another student said, you know what, I just like to hang out at our Wabnode Center. And for me, why that was so critical, as Seija said, it was about what is important to the student. And offering just one type of activity isn't enough. We have a diversity of learners, and we need to figure out what works for each. Another thing, we have a person that within our Wabnode Center who does look at just other events on campus. So an example is we offer basketball and intramural events. So he organizes that. We also do crafts too with one of our staff in Wabnode, and that's offered to students. We also do meditation. So there's a number of activities as we reach out. And to me, our value is that diversity, recognizing our diversity of students.
That's amazing.
Yeah.
So because it's the holiday season, I'm just curious, what is on your wish list for Cambrian, aside from increased funding? Because we all know that we would all like increased funding. In terms of increasing institutional capacity to support student well-being, what would be on your wish list?
That's a great question as we look at it, and we do have a wish list really for a wellness center, a bigger wellness center for accessibility. What we see now is we are receiving students that come to Cambrian that never would have made it to post-secondary, even 10 years ago. So they've been provided accommodations, even for learning disabilities, within their high schools. They're coming to us. We have 60% of our learners are actually not directly out of high school too. So we have learners that are coming back to us that can then receive accommodations they never could have received probably 10, 15 years ago. So when I look at that and how do we reach those students, obviously more resources to do that. A real focus on wellness, I think we need to do that more as a society. So even promoting vitality and more the gym that's on campus that all students have access to, recognizing other activities and social connections that matter. So you say for mental wellness, social connections are critical to everyone's mental wellness. And how do we facilitate that? We're looking at more peer mentorship programs. We have a few across campus. And once again, that focuses on those connections that students can have that will keep them in school and allow them to thrive, not just when they're with us, but when they move on, enter in the workforce.
Of course, that's really important, and especially when students are coming into a campus, you're transitioning from high school to post-secondary, there's often a sense of dislocation that accompanies that. They're leaving their families, and if they're international students, they're leaving their whole community. So I hear you in that the sense of a community, having that social connection is very, very crucial.
And as we enter the holiday season, it's great to see even events that are offered. So an example is our student government is offering a family Christmas dinner that is so well attended for our students. And our student center is packed with students and their children, because their children also, we have, like I said, 60% of our learners are not directly out of high school, and lots of our learners are parents, and just to see their children that are there and celebrating family is just such a great event for them.
Yeah. So from this, whole conversation, I'm hearing a lot of collaborations on campus, off campus are really important, like solidarity, in fact, like in the North among, whether it's among your students or whether it's campus to campus. So, and the Northern Forum that we're hosting here today is one of the steps that we're taking towards building a bigger sense of community among the campuses here. What else do you think can be done moving forward in order to build that connection?
It's a good question.
I think moving forward, this past year we've done a really good job at looking what kind of wellness activities and what kinds of supports and services do we have within the college. I think we need to promote that externally and build stronger relationships within the community, understanding what we do first, being able to communicate that, and how can the external partners help us to ensure academic success for our students. So I think bridging those partnerships in the community is important.
And learning from one another. So today is just a great day to learn best practices from one another and how we can share ideas and concepts with one another. The more we collaborate across the North and even within our own campus, we're always better off, and which means our students will benefit from that.
I think one missing piece out of this conversation are the alternative delivery students or the distance students that aren't on campus or are in our satellite programs, so across the North. So I think you have to look at e-counseling models. You have to look at different ways of delivering services as well. It can't be 8:30 to 4:30 and they have to come right to the college. So we have to look at other ways of doing that. We've identified that as a need. So we need to work on that as well, and I think that's where community partnerships may be, building those relationships will be really important.
That's true. Like, I don't think distance learners have traditionally gotten a lot of attention in terms of like their needs and how they're different from basically the entire campus community. And I really agree with what you said about learning from each other, because obviously at Cambrian, you guys are doing such a great job. You have so much innovative programming, and this is true for really all of the other campuses here. So when you share all that knowledge and what you've learned, I think great things can really happen.
Absolutely.
So thank you so much. That was a really, really great discussion about what's happening here in the North. Like, there are some challenges, but we also see that you've really risen to those challenges and great things are happening. So that's really great to hear. So thank you so much for joining us today.
Thanks for the opportunity. We really appreciate it, and any opportunity to talk about mental health and how we collectively can provide resources to our students. And we know the problem's not going away. It's getting more profound. So thank you so much for inviting us.
No, that's
Thank
great.
you.
So to our viewers, if you are interested in more of this news, events, like just discussions about mental health on campus, go to our website, campusmentalhealth.ca, and subscribe to our mailing list. Because all of that, we have videos, we have webinars, we have all kinds of resources available to you, whether you are a frontline counselor, whether you are a director that works in the institution, whether you're a student leader. So if you found this video to be useful for you, please share it with your colleagues, share it on your campus. Thanks for watching.